wondered how psychiatrists understand their patients' mental health? The answer lies in a detailed psychiatry history, a comprehensive exploration of a patient's past and present experiences, symptoms, and challenges. This process is crucial to diagnosing mental health disorders and creating effective treatment plans. Firstly, establishing rapport is key. This involves creating a safe, non-judgmental space where patients feel comfortable sharing their experiences. Next, the psychiatrist identifies the patient, confirming their name, age, occupation, marital status, ethnic origin, religion, the source of history, contact information, and other relevant personal details to ensure accurate medical records. The heart of the psychiatry history begins with understanding the chief complaint, the primary reason the patient is seeking help. This could range from mood disturbances and anxiety to psychotic symptoms or behavioral changes. For history of present illness, ask about nature of symptom. When it began, how it began. Was there a precipitating factor or event? Frequency of symptoms. How did the symptoms change over time? Exacerbating factors, relieving factors. Treatment history. Associate symptoms. Why is the patient or guardian seeking help now? Risk assessment. Ask about self-harm, harm to others. Thoughts about the future. Thoughts about weapons. Then comes an in-depth look at the patient's psychiatric history. The psychiatrist explores any previous mental health diagnoses, treatments, and responses to these treatments. A closer look at the patient's developmental history follows, shedding light on early family dynamics, academic performance, and social interactions. Personal history asks about aggression, impulsivity, low self-esteem, perfectionism, birth to school to job psychosocial history, marital and children history, pre-morbid history. Ask about personality traits before the development of symptoms, predominant mood reaction to stress, hobbies and interests. The psychiatrist also needs to understand the patient's overall medical history, including chronic medical conditions and current medications, which could impact their mental health or treatment options. Past psychiatric history. Ask about previous signs and symptoms of mental illness. Past medical history. Ask about chronic physical illnesses, history of trauma or abuse, history of thyroid disease or epilepsy. Substance use history is another crucial component. The psychiatrist explores the frequency, quantity, and patterns of alcohol and drug use, along with its impact on the patient's mental health. Drug and alcohol history. Ask about prescriptions and over-the-counter medications, alcohol use, type, quantity, and source. Family history can reveal potential genetic or environmental factors contributing to the patient's mental health, while a review of the patient's psychosocial factors gives insight into current stressors and the strength of their support system. Social history. Ask about marital status, social support systems. Also ask about mental health, violence, substance abuse. Finally, a systematic review of symptoms helps identify mood fluctuations, thought content, and cognitive function. In conclusion, obtaining a detailed psychiatry history is a multifaceted process. It involves building trust, exploring personal and medical histories, understanding substance use and family dynamics, and reviewing symptoms. This comprehensive approach allows for a more accurate diagnosis and effective treatment plan, underlining the importance of psychiatry history taking in providing holistic mental health care.